After a meal, the beta cells of the pancreas produce insulin in response to rising blood glucose levels. Certain cells, such as muscle and fat cells, require insulin for glucose uptake. In these cells, insulin binds to special proteins on the cell surface, known as insulin receptors. In response to insulin binding, glucose transporters inside the cell move to the cell's surface. These transporters help move glucose into the cell. After eating, the blood glucose level peaks at about 60 minutes, rarely exceeding 140 milligrams per deciliter, and returns to the preprandial level within 2 to 3 hours. The low glucose level signals the pancreas to decrease insulin secretion. Blood glucose and insulin levels continue this cycle of rising and falling in response to periods of eating and fasting throughout the day. That's the normal situation in a healthy person. A type 2 diabetic is different. Patients with type 2 diabetes have insulin resistance, where glucose uptake is decreased. In the early stages of diabetes, beta cells overcome the insulin resistance just by producing more insulin. This extra secretion leads to higher than normal levels of insulin in the blood. The blood glucose levels are normal or only mildly elevated, primarily after a meal. As the disease progresses, the insulin resistance becomes more significant. The combination of hyperglycemia-induced damage and the strain of producing extra insulin takes a toll on the beta cell's ability to function, eventually reducing the amount of insulin produced. As a result, the hyperglycemia worsens. Patients with type 2 diabetes have excessive and prolonged increases in blood glucose levels after eating, and it is this postprandial hyperglycemia which often leads to complications.